Vinaka, and welcome to another episode of Health Talk with Oceania Hospitals. And a massive thank you to everyone who have been following our previous episodes, and a massive thanks for the likes and the subscriptions on our YouTube channel. A massive Vinaka Vakalevu, thank you. And that is only possible with you. And today here with me in studio, we currently have the privilege of having our very own specialist here at Oceania Hospitals, our dermatologist, Dr. Harish Gottemukkala. Doctor, welcome to the show, and thank you for accepting our invitation.
It's my honor.
Thank you. Just before we start, could you kindly just introduce yourself, brief background, work experience, and eventually that eventually led you here to Oceania Hospitals?
Sure. I'd like to introduce myself. I'm Dr. Harish Gottemukkala, and Bula Vinaka, Namaste, Namaskaram, and Vanakkam. Yeah, hi people of Fiji. So I basically came from suburbs of Hyderabad in southern state of India, and I am an in-house dermatologist serving Oceania past 1 year. So I undergone my undergrad and postgrad medical training from India, and I finished it in the year 2013. Since then, I have been practicing as independent consultant in the field of dermatology and cosmetology. So overall, I have gained an experience of 12 years. 1 year, the past 1 year being at Oceania, and it includes 2 years of overseas experience in the country of Maldives. So I have worked in various public sector, private sector, corporate health sectors. So in that way, I dealt with all kind of people, including managements, and so I gained a good amount of experience in that way. And regarding my credentials, I've been a life member in the prestigious Indian Association of Dermatology, and I've been a member of other organizations as well, and also I've published few articles in indexed dermatology and cosmetology journals as well, and attended various CMEs in national and international conferences.
Thank you, Doc. You know, dermatology is quite a broad subject, and it's quite a fairly new, topic here in Fiji. So could you just briefly explain dermatology and also the types of services that is offered here in Oceania Hospitals with your expertise being here?
I'm proud to say that Oceania has taken an initiative to introduce the dermatology services here. So it's one of a kind of organization which is offering specialty services to the people of Fiji. And there is a much high need here in Fiji as per the field of dermatology is concerned. So yes, we have taken our initiative to start the department here and procured all the necessities, and also introduced this marketing strategies to create awareness among the public. So one among which is a podcast assisted by you. So dermatology per se, we are dealing with all kind of skin and hair related conditions. So most of the people are this thing that dermatology is something related to only the skin disorders, but it also deals with other appendageal conditions like hair, nails, etc., including oral and genital conditions as well. So per se, we cover all kind of age groups, including pediatric, adolescent, middle age, and elderly people as well. Each individual has their own conditions. Like in pediatric age, we see all kind of infections per se, mostly like eczemas, like atopic dermatitis, which is very much rampant here in Fiji. Also in adolescent group, like cosmetic issues of hair and acne related issues, and middle aged people are presenting with pigmentation disorders and some kind of infections, occupation related eczemas, exposure to the allergens. Mostly the temperate and humid climate of Fiji is a predisposing factor for a few of the eczemas and endemic conditions. Also the climatic related, we have a varied climate from the south to the north, and also regarding the change of climate and all, so people present with the temperate conditions, and we have various ethnic groups. So I had opportunity to meet all kind of ethnic groups here, and they present with multiple skin conditions which vary drastically from person to person. So yes, I'm fortunate enough to address all those issues here, and we do cover certain cosmetology conditions as well here.
Thank you. Just we're gonna get a bit, we're gonna digress here, sorry. Just one question, because here in the Pacific, especially Fiji, we love our food, right? Do you have any sort of like advice or tips when it comes to consumption of food and relating that to better skincare?
Yes. There are better initiatives going on from the side of ministry and as well as from Oceania side as well to create awareness among the people regarding the dietary consumption. So there are multiple policy settings going on. Yes, what your policies are very much advanced and people are following it. And yes, even in the schools they are creating awareness, particularly regarding the skin. I advise to cut down excess intake of refined foods and oil consumption, sugar consumption should be limited. As per se, it creates general health awareness also. So yes, the same thing applies to the skin, especially the protein intake is must for the healthy skin and hair.
Thank you. All right, just going back to consumption, right? One of the questions, this is just basically the last question. Do you have any tips for everyone out there, especially here in Fiji? We love our cover, so to speak, and which also leads to dehydration, and then just trying to get that optimal skincare regimen, especially for us in Fiji who love our cover. Do you have any health tips or advice for us in Fiji?
I completely respect the tradition of Fiji, whereas concerning the kava consumption in a traditional way, in an optimal way, it should be healthy. So regarding the skin conditions, in excess consumption of kava can cause kani, which you are already aware of, which is a traditional associated disease. So advise people to follow the traditions, at the same time take care of their health. So limited consumption, it should be part of tradition, but excess consumption to be avoided to take care of the dehydration and the liver conditions and all.
Thank you very much. And there you have it, ladies and gentlemen. Always remember, MVS, motivation, vision, and skincare is what you need for better skincare out here, especially here in Fiji when we love our cover, and that leads to dehydration. But remember, drink water, drink plenty of water, especially in our climate. And on that note, thank you very much, Doctor, for accepting our invitation and for coming on our show. So from us here at Health Talk with Oceania Hospitals, we'll see you next time. Vinaka.